All right, good morning, everyone. It gives me great pleasure to introduce our speaker for this morning's plenary lecture, Dr. Sarah Henderson. Dr. Henderson is the Scientific Director of Environmental Health Services at the British Columbia Centre for Disease Control. She is also the Director for the National Collaborating Centre for Environmental Health, and she is an Associate Professor at the School of Population and Public Health at the University of British Columbia. And at UBC, she has a very long career. She studied or worked there almost continuously since 1995. She earned her bachelor's there and later her PhD in 2009, and this was in environmental epidemiology with Professor Michael Brower. She then took a short break for a postdoc down in Tasmania in 2009 to 2010. After that, she returned to Vancouver and UBC. Her work is focused on applied environmental health research and with a goal to support public health and policy decisions in British Columbia and in Canada. Dr. Henderson's work spans a wide range of public health topics, including air pollution from wildfires, transportation, industry, and residential sources. She also studies extreme weather, food safety, and water quality. I'm really looking forward to this talk. She will be sharing her experiences and her career spanning aerosol science as well as environmental public health. And please join me in welcoming her for this plenary.
Good morning, everybody. It is so flattering to be invited to be here with you. On Friday in Canada, we recognized the second National Day of Truth and Reconciliation, where we are grappling with our colonial history and 400 years of oppressive policies that have left the Indigenous people in Canada considerably disadvantaged compared with other Canadians. So I do want to start today by recognizing that we are on the traditional territory of different tribes in this region, the Lumbee, the Tuscarora, and the Catawba, I believe is the pronunciation, of people who've lived in this region for thousands of years. Are there any other iron rings in the room? If so, raise your hands. Okay, I see a few, thank you. For those of you who aren't familiar, engineers trained in Canada typically wear this ring on the pinky finger of their working hand as a reminder of their civic duty as engineers. There's legend that these rings were first constructed from metal from the Quebec Bridge, which failed twice during its construction, killing 88 people. That is legend, but it's a nice legend. Although I haven't worked as an engineer for many years, I wear my iron ring as a warning to people that they are dealing with an engineer. I've been told many times in my life that my bluntness will be career limiting. I worked in air pollution abatement and control engineering for some years in the oil and gas industry before being assigned to a project looking at the health impacts of a refinery in the greater Vancouver region. And this was my first introduction to the idea that the air pollution that we were trying to abate and control had health impacts. We never talked about that during my engineering training. We talked about how to meet our permitting requirements. It was a real paradigm shift for me and the project that eventually made me turn my attention to environmental epidemiology and environmental public health. And when I set into my PhD, I had set out a research topic that is very different from where I ended up. At the time, we were looking at sulfur reduction in fuels in Canada, and I was quite interested in the trade-off for refinery communities, because if we're removing more sulfur from raw fuels, we're going to be having more emissions in these communities, and what does it mean for these communities? So that's really what I had proposed and had funded for my thesis research. And then in 2003, this happened. This is the Okanagan Mountain Park fire just outside of Kelowna. Hundreds of homes were lost. No lives were lost, fortunately. And while I was watching this play out, I was thinking that is a really interesting form of air pollution because we cannot abate and control that. So I shifted my thesis research to look at the health impacts of the smoke from these fires during this summer. This was the last paper out of my PhD research, and I think I was one of the first people to be really looking at how else can we measure smoke in the atmosphere. Sure, we have our air quality monitoring network, but it's very limited when we think about how complex and dynamic this type of pollution is. So what else can we look at? And I started modeling with CalPuff. I started bringing in information from remote sensing and started comparing what those different types of information were telling us. I still think a lot about wildfire smoke, and we'll talk a little bit about it today, but I'm so glad to see this field burgeoning, because when we were doing this work, there were maybe 10 papers in the literature. There were a few people in the world who were interested in this topic. This is the future of air pollution. Wildfire smoke will dominate lifetime exposure to air pollution for many people, especially in Western North America. So it is so heartening to see how fast this field is growing. And now, 13 years later, here I am. I, as has been said, am the scientific director of environmental health services at the BC Centre for Disease Control, and also the scientific director for the National Collaborating Centre for Environmental Health. The mandate of the National Collaborating Centre is to synthesize research and translate it into policy and practice. We have a team of knowledge translation scientists that work on this full time. And usually when I introduce myself, my elevator pitch is Dr. Sarah Henderson oversees a broad program of applied research, surveillance, knowledge translation, and training to support evidence-based environmental health policy and practice. She loves big data, environmental public health, and helping stakeholders get the answers that they need. I was recently asked in a student event, what does your day-by-day look like? And I thought about it for a while. Get up, I have a strong coffee. I do what I call my word chores, which is Wordle, Quordle, Octordle, the New York Times crossword, and the spelling bee. And then I sit in meetings all day. I was like, oh, this is not really selling it. But the nice thing about sitting in those meetings all day is that a lot of time I talk to people who make policy directly, and I'm a trusted voice in that conversation. And over the years of my career, I've been able to, really help influence some policy decisions, not only in British Columbia, but in Canada. And that's a really nice position to be in. And that's really what I want to talk to you about today. Some of what I've learned in doing that work. I have the advantage of being able to span from sort of the hard science side through to the political side. A lot of what we do is this. We take really complex, messy, challenging, technical science, and we spin it down into a key message. And I will find myself repeating that key message over and over and over again, because that's what it takes. So it's got to be a good key message. So this is just one example, and I'm going to walk you through a number of examples here. Wildfire smoke is a complex form of air pollution. All of that work, all of that science, that's what it boils down to when we're talking to policymakers, because they are not trained in that science. They do not care about that science, quite honestly. And it is too much to try to bring in all of the nuance. Wildfire smoke is a very complex form of air pollution. And this is what I honestly told myself in the early years of my career as I was learning how to do this. Keep it simple, Sarah. Kiss. Because I would walk out of a meeting and I would realize they didn't get it. They weren't hearing me. I had made it too complex. I had made it too scientific. This is the guiding principle of all of the work that we do now. And every time one of the knowledge translation scientists on our team or research scientists on our team has something they want to communicate, the first thing I'm going to ask them is, what is the key message? And then I'm going to say, make it shorter. And then I'm going to say, make it simpler. It's hard to express how important this is. And the process kind of goes like this. Someone asks us a question. We do the research. Oftentimes, that's literature review, rapid synthesis. We do lots of rapid reviews. Sometimes we do systematic reviews. Sometimes it's primary research, and I'll give some examples of our primary research at the end. We generate an answer. That answer usually comes in the form of a report or a scientific paper, and then we develop the key message. So for the next several slides, what I want to do for you here is tell you the message or the question that was asked to us by a policymaker, give a sense of the research. I obviously can't go into it too deeply, and then spit out the key message at the other end. Quite early in the pandemic, the BC Public Service Agency was worried that COVID might be an airborne disease. They were fairly prescient in this. And they asked us, can COVID be transmitted via the airborne route? This is sort of the summer of 2020. There was not that much in the literature at this point. Very nice study pulling together some data from 3 of the epicenters of COVID, Wuhan, Italy, and New York City, suggesting that the way the virus was behaving certainly indicated that it may be airborne transmission may be the primary route of transmission. A little bit later, more evidence building in the literature that indeed we do have a virus that is probably transmitting via the airborne route, and we should start taking precautions around the indoor environment. Now, I mentioned earlier that this happens in a political framework, and I've never been so challenged by the translation of science to policy as I have been in the political environment that surrounded COVID. This is the last update. So we wrote this report for the stakeholder. We suggested that, yes, we do need to be concerned about COVID transmission in the indoor environment via the airborne route. I work for the BCCDC, so we try to ensure that the agency is putting out good information. And this is what the last update of our web page is. Most COVID-19 infections are spread from one person to another through respiratory droplets. But droplets come in a wide range of sizes, and they behave differently depending on their size. Larger droplets are heavier and they usually fall to the ground within 2 meters. Smaller droplets, also known as aerosols, are lighter and they can float in the air for longer. Smaller droplets can collect in enclosed spaces when there's not enough fresh air. Indoor accumulation is greater when more people share a space, spend more time together, or exercise, sing, shout, or speak loudly. These conditions can lead to COVID-19 transmission. Opening windows and increasing fresh air intake with mechanical ventilation are important protective measures that can help reduce the spread of COVID-19. So there's a link to the actual report there. There must have been at least 20 different authors involved in writing this little piece of information on our website. I guarantee you it looks nothing like it did when I first submitted it, but it's a process. Regardless, the key message that came out of this review for us is ventilation is one important tool for reducing COVID transmission. There's a whole suite of tools that we have at our hands. Ventilation is one of them, and it's important. Next question from WorkSafe BC. Really thinking about the next pandemic this time. Are these plexiglass barriers that we have up everywhere actually doing anything? Are they worthwhile? Some interesting, very niche research in this area. Unfortunately, I don't have a pointer, but here we're looking at tests of no barrier, a barrier with a hole, a barrier with a hole and a HEPA filter, a barrier without a hole, a barrier without a hole and HEPA filter, and then a really big barrier. So those are the bars that we see across here, and then 2 different distances away from the barrier. And, you know, the difference between no barrier and a barrier with a hole is really nothing, but there's some indication here that maybe these barriers, especially when combined with HEPA filters, might be useful. One of the really fun things about looking at this research is there's great pictures of super creepy looking mannequins in a lot of them. And here we are with some super creepy looking mannequins. Again, some indication that these barriers might be useful. Looking at that along with the epidemiologic research, what we come up with are barriers are valuable for high frequency, short duration contact. So putting them up between seats, I'm sure in a cafeteria, I'm sure we all know that that was never a really great idea. But in these areas where maybe you have someone at a cash register and they have a lot of contacts every day, but they're pretty short, those are the places where they can maybe help to protect people. This timer here says I still have 45 minutes, which is sort of dangerous. And our own agency asked us, whoa, we're hearing that maybe masks aren't just a source control measure, that they might actually be able to protect people from the virus as well, okay? And there's quite a lot in the literature at this point on the protective value of masks, so we go through the process of pulling all that literature together. We have a very long review document on this. It is posted on the NCCEH website. Oh, now the timer started, thank you. I love this paper. I have read it so many times, looking at the fact that, okay, if we have layers of different fabrics, that can actually provide almost as much filtration as an N95, and in some cases more filtration, and really the thing that matters is the fit. The thing that matters is the fit. So again, we write a report, we say, yep, masks can certainly help the wearers. A well-fitted N95 or similar respirator, or a well-fitted multi-layer mask, or even a well-fitted surgical mask can all help to protect the wearer. What we get on the website is masks are most effective when fitted, worn, and handled correctly. They act as a barrier and in combination with other measures can help prevent the spread of COVID-19. Okay. What we really would have liked to have said is, please wear a mask, a good mask, fit it well, it can protect you. But again, this got filtered through the politics of the situation and came out somewhat different from what the science suggested on the other side. Somebody once described to me my leadership style as ready, fire, aim, and I was like, oh yeah, that's exactly right. I just go. And I course correct along the way. And we've done a lot of that in COVID. We've gone with the evidence that we've had available, and as the evidence has changed, we've course corrected. I think we just go that way in science. I was talking with somebody the other night about the James Webb Telescope and the fact that, you know, all of astrophysics is having this course correction right now. And it's an important part of the process, and a lot of times you will find policymakers who want the answer, and they want the last answer there's ever going to be. And one of the roles that I and others end up playing is saying, you know what, this is where we are right now. It might change, and helping them kind of walk them through that uncertainty. Really, the key message around masks is air has to pass through the mask, not around it. And this became handy when we were looking at our communications around wildfire smoke and masking later that year after we'd done the review. So we were able to take all that we had learned from that review and apply it to wildfire smoke to say, yeah, an N95, a well-fitted N95 respirator or similar is best, but other masks, if they are well-fitted, can also help to protect you from the smoke and wildfires. So I was reading through my slides last night, just going over what I wanted to say. Is PM 2.5B the design standard for reducing smoke in commercial buildings? And I thought immediately of Ralph Wiggum's, me fail English? That's impossible. I'm sorry for this egregious grammatical error, but this is a question that came up in ASHRAE GPC 44. Anybody else from GPC 44 in here? Okay, this is the guideline for wildfire smoke in commercial buildings. So this guideline is almost ready. It'll go out for public review in the next month or two. But we had this question from the team is should we be thinking of PM 2.5 as the design standard, or is it something different? And this sent us into the literature on the size distribution of wildfire smoke particles and other wood smoke particles. I don't want to get too far into the nitty-gritty details here, but this figure is a really nice demonstration that, as particles age, the size distribution does shift somewhat. We also spent quite a bit of time looking at some of these amazing studies that folks are doing with airborne technology. This is from the FireX AQ study, and we've got transects of these smoke plumes, and in addition, the evolving size distribution of the particles in these plumes. There's quite a lot out there to sort of pull together and look at, thanks to the hard work that so many aerosol researchers are doing. And we come up with the key message that most wildfire smoke particles are less than 1 micron, but the size distribution does change in the atmosphere. So really, we should be looking at a smaller size when we're talking about the filtration and the capability of the filtration, how long filters are going to last and work well. BC Housing is the social housing provider and funder in British Columbia, and lots of low-income people that they service. We know that these populations are going to be more susceptible to exposure from wildfire smoke, but less able to afford the technologies that would help to protect them in the indoor environment, such as relatively expensive HEPA air cleaners. So the question was, can we recommend these box fan air cleaners as a less expensive alternative that we're seeing? At the time that we were asked this question, there was almost nothing in the literature. This paper had just come out, and it was one of the first to, clearly demonstrate in a peer-reviewed piece of literature that indeed there was some value in these box fan air cleaners. But this is an example of where we turn to our own research. So this is Chris Carlston's Air Pollution Exposure Lab at UBC, and it was essentially shut down during the pandemic. They couldn't do any research, but we were able to get in there and do some testing of a couple of different designs to see two things. First of all, did they do anything? And second of all, we were a little bit worried about this question of the temperature of the fan motor with a filter attached, meaning that the extra, questioning whether the extra load would end up being a potential fire risk. And what we found is that these, this particular design had a relatively low clean air delivery rate, but, similar to a small commercial unit. And we also found that the temperature on the motor did go up, but it didn't go up too much. Since then, there's been so much in this space that it's not even funny because of pandemic and a really big review on temperatures and whether or not they can become dangerous. So, we did this research to give ourselves our own information and to make some recommendations. But once again, the literature has come along really quickly. Our conclusion is that an improvised air cleaning device is better than no air cleaning device at all. That's the simple key message. Ready, fire, aim. What I think we're going to see in this particular literature might strengthen that message. The newer papers that I'm seeing are maybe a little bit stronger than those initial papers that we'd been through, especially with some of these new ways that people are strapping these things together. So I won't be surprised to see this message evolve. But currently, the message is it's better than nothing. This question came to us from the BC Ministry of the Environment. We have an aging network of PM10 equipment in the province, a bunch of TOMs. They're expensive to maintain. Question is, there's no Canadian ambient air quality standard or cake for PM10. Can we get rid of these? Do we still need to measure this? It's a good question. This is an area where we had to do only primary research because nobody else can really address that question for us. We can look at the literature, we can consider what's being said about the coarse fraction, but really we need to understand what this means in British Columbia. So we went out and did a study looking at the health impacts of the coarse fraction, and in a bunch of interior communities, what we found is that during springtime, the coarse fraction was actually associated with a unexpectedly high impact on mortality. Now, if you're not from a northern climate, you might not understand what springtime road dust is. What happens is over the winter, all of the traction material, all of the brake wear, all of the tire wear gets entrained in the snow. And then when the snow starts to melt in the spring, all of that gunk gets resuspended into the air, usually over a couple of weeks. And if you've ever been in a springtime road dust situation, you know you can kind of crunch on the air. It is quite disgusting and potentially quite toxic, as supported by this study. So since then, we've gone out and taken measurements with a high volume sampler of PM10 at roadside in one of the most impacted communities. On the left-hand side here, we have the PM10 concentrations from the high vol on road dust days, these springtime road dust days and other days. And on the right-hand side, we have the contribution of trace elements to that PM10. That's a lot of lead and copper and chromium and zinc and other things. So we have a really high heavy metal content in this springtime road dust when it's happening, which might be associated with the high mortality that we see on these dusty days. So road dust remains an important environmental exposure for interior BC communities. Yeah, perhaps we can dump some of our TOMs in other locations, but when we're talking about these communities where it does get snowy and we do know there's road dust problems, we better keep those TOMs operating and maybe even consider implementing or sending out some more. And the final question, do we need to worry about the air quality impacts of cannabis cultivation? This comes to us from Metro Van. Metro Van is the air quality regulator in the Greater Vancouver area. And there's a lot of cannabis being grown in the Greater Vancouver area. So this is a concern. There's a lot of volatile organics, certainly lots of potential for the formation of ozone and secondary aerosol. And they wanted to better understand, what the real world implications of this may be. This is a study that I've been working on with Naomi Zimmerman and Amanda Jiang. The first thing we did was launch Smell Vancouver. So we wanted to get information about the odor landscape of the city from people, because we figured that would help us to identify where the potential air quality impacts of cannabis cultivation may be. And we've been running Smell Vancouver for a couple of years now. You can see on the bottom where we get reports. People can tell us how bad the odor is and then tell us what they did or how they were feeling because of that odor. And now we're starting to match that up with information from the Plume van, which can go out and drive through Vancouver and measure a wide range of things. So on the top here, we have I think it's the PM concentrations measured by the Plume van, and then each of those dots is showing where odors have been reported. And we've got a bunch of yellow dots where we believe that the reported odors are related to cannabis cultivation. And at the same time, we did this big literature review. Our student Davi just published this recently, looking at the air quality impacts of cannabis cultivation, and particularly the odor from cannabis cultivation. And overall, I want to leave you with the key message that the odor from one cannabis plant can be as much as the odor from one chicken. I thought you would laugh more at that. Really, what all of this work has concluded is that there may be small air quality impacts from cannabis cultivation, but probably the biggest impact that we need to worry about is the odor and the health impacts of those odors. And odor and its health impacts is a very tricky landscape, because generally odors themselves do not have direct health impacts, but they are mediated through a stress pathway. If people find the odors stressful and unpleasant and noxious, then they are going to be at far higher risk of experiencing health impacts from those odors than people who don't mind them as much. And it is an air quality issue, even though it's maybe not the type of air quality issue that most of us are used to thinking about. So, how can aerosol researchers make their work relevant to applied public health? talk to us. Honestly, there's nothing quite like health to motivate research and research funding. It's a very powerful way to convince people that things need to be done. And there is a lot of need for, I would say, more research that is directly applicable. So in these cases where we've gone out and done our own primary research, it would be incredible for us to be able to partner more broadly with folks like you on those types of questions. So my 2 key messages for you today are keep it simple and talk to your friendly applied public health researcher or professional about your research program if you are looking to direct it to this connection between science and policy, because they will know what's needed. They will know exactly where they need the research to go for the questions that they are trying to have answered. Just a thank you to some wonderful colleagues at the BCCDC, the BC Centre for Disease Control, UNBC, and the Ministry of Environment in British Columbia. And that's all I have for you. I think I'm a little short, but that's okay. There's time for questions. Can't really see if there's